We want to support you on your path to hear and be heard. If you are seeking insurance coverage for your sound processor replacement, the cost of repairing a malfunctioning sound processor, or parts and accessories, it's important to understand what insurance companies deem medically necessary. We're here to explain how medical necessity is defined. Cochlear's implant technology is recognized as the standard treatment for severe to profound nerve deafness or mixed conductive and sensorineural hearing loss. Most insurance companies cover them. But what about the external equipment you will need to periodically replace or add to hear now and always? To qualify for reimbursement by most insurance companies, a sound processor repair or replacement and parts and accessories must be deemed medically necessary. Which leads to the question, how is medical necessity demonstrated? Insurance companies define medical necessity differently, but there are common themes that will help you understand medical necessity when seeking reimbursement. In general, medical necessity is defined as healthcare services that a clinician would provide to a patient for the purpose of evaluating, diagnosing, or treating an illness, injury, disease, or its symptoms. Sound processors, accessories, and parts are most often considered durable medical equipment, or prostheses, so be sure to check with your insurance provider to identify if these benefits are covered under your plan. Here's the approach for demonstrating medical necessity for these items. Your clinician establishes medical necessity by describing your diagnosis of hearing loss, providing history of you using your Cochlear technology to treat your hearing loss, and supporting justification as to why the services requested are needed to continue to keep you in sound. In other words, in the letter of medical necessity, your clinician provides a sensible clinical recommendation for treatment that includes the equipment that is necessary for your Cochlear device to function. The letter should clearly demonstrate that the Cochlear sound processor, parts and accessories provide functionality to treat your hearing loss or improve your hearing, decrease risk to your personal safety, and improvements in your quality of life. The letter of medical necessity provides proof that the item or items being ordered are required to receive the full benefit of your Cochlear technology, allowing you to access sound and the ability to communicate. This may include pre- and post-clinical test results that demonstrate improved performance. Finally, your treating clinician will provide medical codes in the letter of medical necessity. Insurance companies rely on a healthcare common procedure coding system to identify medical procedures, services, and equipment covered under their policies. HCPCS codes for Cochlear processors, parts, and accessories are listed in the Cochlear Insurance Support Center. Please check with your insurance provider or with Cochlear periodically, as these codes are subject to change. We hope this information helps you understand the medical necessity concept as you travel through the path to hear now and always. If your current sound processor is not fully functioning, a replacement sound processor must demonstrate medical necessity to secure reimbursement from your insurance provider. It must be proven that the existing processor has exceeded its useful lifetime and no longer meets your needs to communicate, hear safety sounds, and experience uninterrupted hearing. If your insurance will not cover replacements, repairs are considered medically necessary. In cases of obsolescence, replacements typically meet the justification of medical necessity as the device is no longer being serviced. Health plans have their own definitions of what is considered medically necessary, but typically include anything that improves your hearing or is required for the medical device to function, such as cables, coils, magnets, and rechargeable batteries.